I want to thank everybody for the tremendous support. I'm going to Walter Reed Hospital. I think I'm doing very well, but we're going to make sure that things work out. The First Lady is doing very well. So thank you very much. I appreciate it. I will never forget it. Thank you.
Breaking news tonight. President Trump releasing that video just moments ago. He thanked everyone for their well wishes and their support. The president arrived for treatment at Walter Reed Medical Center after he and the First Lady tested positive last night for COVID-19.
It is being described as a precautionary measure, but he will be there for a few days. Rona Tumblety joining us now for the latest on the developments and what we are expecting moving forward. Rona.
That's right, guys. Just a very short time ago, the president taking a moment to tweet a video message before heading to the hospital. He's expected to work from there for the next few days. We also learned earlier this afternoon that the president today received an antibody cocktail as a precautionary measure. In addition to that, he's been taking zinc, vitamin D, famotidine, melatonin and aspirin. Now, all of this as many on Capitol Hill and around the country woke up to the news this morning.
I want to thank everybody for the tremendous support. I'm going to Walter Reed Hospital. I think I'm doing very well, but we're going to make sure that things work out. The First Lady is doing very well. So thank you very much. I appreciate it. I will never forget it. Thank you.
The president will now be spending the next few days working from the presidential offices at Walter Reed Medical Center. That decision made this afternoon on the advice of his doctor, among others. He and the First Lady had both been in isolation at the White House after confirming on Twitter they'd tested positive for coronavirus. Prayers for their swift recovery have been pouring in, including from Congressman Rodney Davis, who contracted the virus in August.
Hope that they have the same asymptomatic experience with COVID that I did.
Word from the White House today repeatedly stating the president remains in good spirits.
He's had mild symptoms, but he is hard at work. We're having to slow him down a little bit.
But how and when he contracted COVID-19 is unclear, though it may have been through interaction with senior aide Hope Hicks. She tested positive Thursday, but we also don't know when she was exposed.
I'm not going to get into the TikTok.
Chief of Staff Mark Meadows says news of her diagnosis came yesterday, just before the president's helicopter left the White House for a fundraiser in New Jersey.
We discovered that right as the Marine One was taking off yesterday. We actually pulled some of the people that had been traveling in close contact.
When asked why the president made the trip after learning that news, Press Secretary Kelly McEnany had this to say.
It was deemed safe for the president to go. He socially distanced. It was an outdoor event, and it was deemed safe by White House operations for him.
Now, the New York Times is reporting the president's symptoms include a cough and a low-grade fever, but the paper also says Hope Hicks was seemingly showing minor symptoms of the virus on Wednesday when she traveled with the president to Minnesota for a campaign rally. It's understood she was quarantined on the return flight. Now, several other staffers, including Vice President Mike Pence, have also since been given the all clear. However, the virus is continuing to spread in Washington. Utah Senator Mike Lee, who was at the White House on Saturday, is now among those testing positive.
Okay, Bruna. Hear more from you in a little while. In the meantime, President